Bloating is more than just a minor inconvenience. It can be a daily struggle that affects your comfort and confidence. But what if you could pinpoint the cause and find effective solutions? Let's explore the reasons behind bloating and discover practical tips to alleviate it. What is causing my bloating? Bloating can stem from various factors, including dietary habits, food intolerances, digestive disorders, and lifestyle choices. Overeating, consuming high-fat foods, and eating too quickly are common culprits. Foods like beans, lentils, carbonated drinks, and cruciferous vegetables can also contribute. Identifying the root cause is the first step to relief. Pro tip: start a food diary to track what you eat and any bloating you experience. This can help you identify patterns and potential triggers. How can I identify if a specific food is causing my bloating? Pinpointing specific foods involves careful observation. Keeping a food diary is a practical approach. Record your meals and note any bloating or discomfort. This can help you identify which foods might be causing your symptoms. Common offenders include dairy products, gluten, and high-fiber foods. Pro tip: try an elimination diet by removing suspected foods for a few weeks and then gradually reintroducing them to see if symptoms reappear. Are there any medical conditions that could be causing my bloating? Bloating can sometimes signal underlying medical conditions like irritable bowel syndrome, IBS, celiac disease, or small intestinal bacterial overgrowth, SIBO. Persistent or severe bloating warrants medical attention. A healthcare provider can evaluate your symptoms, perform tests, and diagnose any underlying conditions. Pro tip: keep a detailed symptom journal to share with your doctor. This can provide valuable insights into your condition. What lifestyle changes can help reduce bloating? Several lifestyle changes can alleviate bloating. Eating habits play a significant role. Chewing food thoroughly and eating smaller, more frequent meals can aid digestion. Avoiding carbonated drinks and chewing gum can also help. Regular exercise, such as walking or yoga, improves digestion and reduces bloating. Managing stress through relaxation techniques like deep breathing or meditation can positively impact digestive health. Pro tip: incorporate a short walk after meals to aid digestion and reduce bloating. Are there specific foods or drinks that can help reduce bloating? Certain foods and drinks are known to help reduce bloating. Ginger is a natural anti-inflammatory that soothes the digestive system. Peppermint tea can relax gastrointestinal muscles and reduce bloating. Probiotic-rich foods like yogurt, kefir, sauerkraut, and kimchi balance gut bacteria and improve digestion. Pro tip: start your day with a warm glass of water with lemon and ginger to kickstart digestion and reduce bloating. How does hydration affect bloating? Proper hydration is crucial for digestive health. Drinking enough water maintains fluid balance and prevents constipation, a common cause of bloating. Herbal teas like peppermint or chamomile can hydrate and soothe the digestive system. Staying well hydrated throughout the day is essential for reducing bloating. Pro tip: aim to drink a glass of water before each meal to aid digestion and prevent overeating. Can exercise help with bloating, and if so, what types are best? Physical activity aids digestion and reduces bloating. Gentle exercises like walking help move gas through the digestive tract. Yoga poses that involve twisting or stretching the abdomen, such as the seated twist or child's pose, can release trapped gas and reduce bloating. Abdominal massages can also stimulate digestion. Pro tip: incorporate a few minutes of yoga or stretching into your daily routine to keep your digestive system moving smoothly. What role do probiotics play in managing bloating? Probiotics balance the gut microbiome and improve digestion. They are particularly effective for bloating caused by an imbalance of gut bacteria. Probiotic-rich foods like yogurt, kefir, sauerkraut, and kimchi introduce beneficial bacteria into your digestive system. Probiotic supplements are also available. Pro tip: choose a probiotic supplement with multiple strains of bacteria for the best results. Consult with a healthcare provider to determine which strains are most beneficial for you. Are there any over-the-counter remedies that can help with bloating? Several over-the-counter products can alleviate bloating. Simethicone helps break up gas bubbles in the digestive tract. Activated charcoal absorbs excess gas. Digestive enzymes, such as lactase for lactose intolerance, help break down specific foods that cause bloating. Pro tip: always read the instructions and consult with a healthcare provider if you have concerns about using these products. When should I see a doctor about my bloating? Persistent or severe bloating can indicate a more serious health issue. Seek medical attention if you experience bloating with severe abdominal pain, unexplained weight loss, persistent diarrhea or constipation, or blood in the stool. A healthcare provider can evaluate your symptoms, perform diagnostic tests, and determine the underlying cause. Pro tip: don't ignore persistent symptoms. Early diagnosis and treatment of underlying conditions are crucial for managing bloating effectively. Conclusion: bloating is a common issue, but understanding its causes and how to address it can significantly improve your comfort and quality of life. By identifying specific foods that cause bloating, making lifestyle changes, incorporating beneficial foods and drinks, and seeking medical advice when necessary, you can manage and reduce bloating effectively. Remember, everyone's digestive system is unique, so it may take some trial and error to find the best approach for you. With patience and persistence, you can find relief from bloating and enjoy better digestive health.